To the audience, to our friends, hello, good afternoon, good evening. My name is Jimmy Briggs. This session is part of the School World Forum's Ecosystem Day, and is wholly curated and hosted by the Carter Center. I also want to let our audience know the session is being recorded and may possibly be streamed and released afterwards on the School Foundation platform. The title of the session is The Future is Now, a Unified Approach to Mental Health. Addressing mental health is more urgent than ever. As new health, economic, sociopolitical, and environmental crises emerge, the burden of poor mental health grows and threatens our ability to recover, thrive, and achieve the Sustainable Development Goals. The impact of COVID-19 urges us to create a future where mental health and well-being is a human right, services are accessible, and cross-sectoral action underlies prevention and response efforts. This session will hopefully percolate discussion on a paradigm shift to a unified approach by top mental health prevention, promotion, and preparedness experts. It's my honor to introduce our panelists, Dr. Ben Miller, President of Wellbeing Trust, Sarah Klein, co-founder and CEO of United for Global Mental Health, Terry Cobham, journalist and the Senior Associate Director of the Rosalynn Carter Fellowships for Mental Health Journalism and Media at the Carter Center, S. Benedict Silson, Country Program Lead in Liberia for the Carter Center, and Dr. Mark Van Omeren, Head of the Mental Health Unit of the Department of Mental Health and Substance Use of the World Health Organization. Thank you all for joining us this morning. I'm going to kick off first with Ben Miller. Could you talk about, for those in the audience, kind of give us an overview of the landscape of mental health right now?
Absolutely. Thanks, Jimmy, and thanks for the opportunity to be here and talk about such an important topic. Dare I say one of the most important topics, if not the most important topic, our mental health. So what's the current landscape of our mental health in the world? I think there's a lot of data that we've been able to look at over the last 2 years. The WHO has told us in the first year alone, the global prevalence of anxiety and depression increased by 25%. And just this past week, a global survey on mental health showed a disturbing decline in the mental health of our youth, specifically ages 18 to 24. Here in the US, work that we supported in collaboration with Kaiser Family Foundation found that during the pandemic, 4 in 10 adults reported symptoms of anxiety or depression, which was up from 1 in 10 before the pandemic. And our kids, I worry about this a lot, including my own kids. I mean, the Center for Disease Control here in the US has reported that more than 1 in 3 high school students experienced poor mental health during the pandemic, and nearly half of students felt persistently sad or hopeless. We've also seen this increase in emergency department visits, the declaration of mental health crises from hospitals. And to be clear, a lot of these data were problematic before COVID, and COVID has just exacerbated them and really made the trends that we were already seeing going the wrong direction even worse. So I just want to challenge us for a moment to think about this, because all that's happening in the world, this is on our watch. We are the leaders for this time. We are the ones who make the decisions about what we do next, what direction we go. And the last 2 years have given us a moment, I think, to take this collective pause and assess what's working and what's not, and to truly begin to come up with a game plan, a vision together of where we need to go. When you start to do this, it forces you to acknowledge that the structures that we all inherited and have been created over time are not capable of meeting this moment. And despite all these well-intended plans, we still treat mental health as this one-off, this thing that we look to when we have to, but not the foundational aspect for our health that it is. And our fragmented structures really enable that. But now I think it's a moment, Jimmy, a propitious one at that. And just one more comment here. I actually think there's a lot of things that we can do to take advantage of this moment. We've learned a lot and we should apply those learnings. So first of all, I think that we have to really aggressively work to bring care to where people are. During the pandemic, we've seen technology play a role, which has been helpful for some, not for all. We've seen trends over the last decades show up more, like where people want care in places like primary care or schools. And one of the best ways that we can solve this pervasive quandary of lack of access is to create more places where people can receive care. It's a theme that we continue to hear during the pandemic. Second, I actually think we have to rethink our entire approach to workforce. We're never going to have enough clinicians to meet the demand. And if anything, COVID has reminded us of that. let's begin to really think about how best to empower an entire new generation that they can possess the tools, resources, and skills to help each other. I mean, this is care in community, by community, for community. It's care that's so upstream, it can't help but have a major effect downstream. Why not begin to democratize this knowledge, these skills, these resources? And finally, I think we have to redo our structures so that mental health is everyone's responsibility and not just left to an anemic mental health system. Similar to the thinking around workforce, our financial, administrative, training, and delivery structures really reinforce that mental health is this specialty thing. And if we're going to be successful at reform, we have to see how our current structures hold us back. So as I said, I think this is a critical moment. This is a propitious moment. This is on our watch. What happens next is our legacy. Will we stay safe? Will we protect the status quo? Or will we rise up together and demand for something more, something better? I plan personally to take risk. I'm sure we're going to talk about that today. COVID has put mental health front and center in all our lives. And let's use this moment and work together to leave a system for mental health for the next generation. So look forward to our discussion, Jimmy. Thank you.
Thank you so much. You framed the conversation so well for us today. I appreciate that. Sarah, I want to go to you. Could you explain for us, or give us kind of a portrait of the state of investment in mental health? I mean, why is integrating mental health and physical health cost effective?
Thank you, Jimmy. Thank you to Skull for inviting me and for joining this group. It's a real pleasure to be here. I wanted to build, as you heard, on what Ben has already said and his passionate call for action. So to your question, Jimmy, I think in overall terms, what we're seeing is very low levels of investment. So mental health on average is around 2% of government health budgets. And in low middle income countries, that can fall to under 1%. We'll talk more, I'm sure Benedict will, about the situation in Liberia and the work that we did with the Carter Center in Liberia. But that's a classic example of a country where, with a population of only around 5-6 million, their actual investment in mental health, despite having a reasonably up-to-date mental health legislation and laws and policies, is pitiful. But Benedict can talk about that more. I think the way to try and make the case is, as Ben's already said, there is a case for action on mental health that is an inalienable right. Everyone should have the right to good mental and physical health. It should be treated in parity to physical health. But there's also a cost effectiveness. So what we found in our research that we've done is that if you integrate mental health into, for example, services and support for HIV and TB, you could actually cut mental HIV infections by 1 million between now and 2030, and you could actually stop 14 million TB cases between now and 2030. There is overwhelming evidence of the intersection or the comorbidity, if you like, of physical and mental health conditions. There is no reason why we can't tackle mental health at the same time as we tackle physical health with better results for all. And it is deeply frustrating to see organizations that are investing millions or billions into HIV or TB not recognizing that the people at risk are looking for support for their mental health. So in the case of TB, we're seeing huge numbers of people that are vulnerable to HIV or TB infections who actually would benefit from mental health support. So there's a cost effectiveness around health conditions, but to Ben's point, there's also a cost effectiveness, which is obvious, around investing in mental health support in schools and universities and in both professionals, but also peer-to-peer support, which is something that many teams in particular want to do. They have a deep sense of service. They want to support their peers. It also extends to reproductive health. One of the impacts of COVID has been a lack of access to contraception, for example, for millions of women. And that leads to a really difficult situation where arguably mental health is just as important as physical health, not only for women and for expectant mothers, but also then for their children. Children of people with who live with a mental health condition are more likely to have challenges in terms of nutrition and their emotional and physical development. So there are lots of reasons, good reasons, for trying to invest in mental health and for the cost effectiveness of doing that in that combination with physical health conditions and other sectors. Thank you.
Thank you, Sarah, and thank you again, Ben, for setting us up so well for this rich conversation. Sarah, for your amplification. So you basically set up remarks and insight from our colleague, Benedict, to speak. And I want to pivot to you, Benedict. Good to see you again. Before, I see we have some questions and comments in the Q&A button. I just wanted to elevate that as my colleagues and panelists here are speaking and responding to questions for myself and each other, hopefully, please, I invite the audience to populate questions or reflections upon what you're hearing, and I will integrate those into the conversation as well for response. So the Q&A button is at the bottom of the screen, as you'll see, and as you're plugging in questions, I will integrate those into our conversation. Benedict, I wanted to go to you. I mean, you're working at the ground level, at the country level in Liberia, on behalf of the Carter Center. Could you share with us some of the challenges, but also how you're seeing in Liberia through your Carter Center experience, being the lead there, how different sectors and interventions are reinforcing each other to build, to sustain the mental health system in Liberia?
Thank you very much, Jimmy. Thank you everyone for joining this. So clearly, Jimmy, the challenges are many, but as Sarah said, there have been some progress made so far. So we are appreciative of where we've come so far. And so one major challenge is clearly lack of finance. And that really affects a lot of things in the sector. So quite a long time, Liberia never even had a mental health budget. It was only by 2020 that we had the first mental health budget. And that was through a lot of work, collaboration with partners, and real advocacy to get to that level. And the budget that we had was more than insignificant. I'm talking about $25,000 for an entire country. But the big point there is that at least at this time, we have a dedicated mental health budget that we can talk about, and we can ask for it to be increased. And so in general, I'd like to say, thinking about innovative strategies, clearly from a global mental health standpoint, we talk a lot about tax shifting and also integration, very important. But additionally, from working on the ground, what we've seen more is to also emphasize the issue of aligning our mental health with our national agendas and collaboration with government and key stakeholders, and considering sustainability from conceptualization, from design throughout implementation and closure. And because all of these can be well aligned with capacity development, like workforce development, establishing policy, and supporting human rights and inclusion. And from the work in Carter Center, those three areas have really been our strategies to working in Liberia. And so we adopted this three-pronged approach from the very beginning, and it's demonstrated positive results in terms of providing, improving, and maintaining a kind of holistic mental health care approach in the country. And why I think that is important, it's not just ingenious, but it is necessary and meaningful. So take, for instance, building a strong workforce in a place like Liberia involve boosting the competencies of specialists and non-specialists in general. And by 2009, the narrative in Liberia was that one psychiatrist for the entire country. And this meant a lot. It meant general lack of evidence-based systematic mental health service delivery at the primary, secondary, and community levels. And so people from across the country with mental health issues, they had to be transported on predominantly bad roads to come to Monrovia for treatment. So by 2010, and through the collaboration with the Ministry of Health and regulatory authorities, we were able to help change that narrative practice in general to develop a new core of mental health professionals, mental health clinicians who complete an intensive 6-month training, and then they are licensed to practice by the board. And this kind of collaboration really built on the tax shifting model and integration strategy has really helped the country, because these workers are spread across the country. To date, we have trained over 360 of them in many counties are providing services at the very low level that ordinary people are able to access, and not only at the highest level of care. And this is one important strategy. And I would also like to point to the fact that this integration doesn't necessarily have to be within the healthcare system. We're talking about school or system as a whole, getting mental health services, building school system, and also collaboration across other platforms of services, and collaboration with other partners like the media. I'm sure Carrie will talk a lot about this, how to get the media involved, what role the journalists can play. We're talking about sensitive reporting, we're talking about increasing awareness, and essentially also working with mental health service users. No one can talk more and better articulate the issue eloquently than persons who have lived experience. And our interaction in Liberia over the 10 years as the Carter Center has really been about addressing all of those areas so that the work is meaningful to the country.
Thank you so much, Greg. I appreciate that. I want to go to Mark. You know, and Benedict's description made me think about this. You know, and as Ben noted at the outset, I mean, we, you know, for the past 2+ years have been in the midst of a global pandemic affecting everyone on the planet, compounded by regional and local and state crises. Why, from your perspective, Mark, why is mental health care so essential in crisis preparedness and response? I'm thinking, you know, about the pandemic, but also, you know, what's happening in Ukraine and just, you know, the everyday stresses that we're all facing.
Thank you so much for your question. Thank you for having me, and to be here in conversation with the panel and the audience. It's great. There's a lot to say about emergencies and crises and why it's important to focus on mental health in crisis. First of all, for the normal reasons. The reasons why investing in mental health is for public health, for human rights, for development. It's very important. But these problems are more acute in crisis. There's more suffering. The rates go up, and communities need to recover afterwards. So the reasons to invest are even higher. Overall, the rates of problems of mental health and emergencies, I mean, go up. We have looked at the data in a variety of ways, and they at least double. And over time, they go down a bit, but they stay higher. So a lot of people, even though most people are resilient, overall, communities are left with legacies after they have gone through a war or a natural disaster or another, or COVID-19. So, you know, what is to be done? There's a number of acute responses needed, whether this varies from crisis to crisis. Right now in Ukraine, the needs are variable from the acute stress that people are experiencing, fearing for their lives, which is would say a normal reaction, to all kinds of other difficulties, including, for example, the safety of people with severe mental illnesses who are living in institutions. In Ukraine, there are 35,000 people right now living in in mental health facilities, in asylums and other places, and they're at extreme risk of being hurt by the war. And WHO makes resources available for partners, convenes partners, a situation analysis, and supports the government in coordinating the response. But in the long run, there's so much to be done because the rates are up in the long run, even if they come down a bit over time. So what one needs is actually a mental health system, a functioning community mental health system that reaches to every corner of the area, just like you would if there's no crisis. Only this mental health system needs to be particularly good in dealing with issues of loss and trauma. And what to do? There's many things to be done. One has to make a choice. And I very much am a great fan of the Carter Center program in Liberia because there's so many things to be done in Liberia. But the Carter Center chose to work on human resource development and making sure that in the faraway areas away from the capital, that there's everywhere at least one person who is fully trained up in mental health, which is really a catalytic for making sure that a system develops. So there's many things to be done, and what is being done is really important.
Thank you so much, Rick. I want to come back to you. I'm going to go to Carrie because this is relevant to my comment. I spent a lot of time in a prior life as a journalist covering conflicts and crises around the world, and so I understand very well what you're talking about, both in the immediate situation when a crisis is unfolding, but also in the aftermath, just the process of having to restart or build something that doesn't exist, but obviously which there's a need in terms of mental health response and wellness. Carrie, I want to go to you, and I do have to say, which I didn't say at the outset of the conversation, one reason I'm so happy and proud to be a part of this conversation is that I am myself an alum fellow of the Carter Center Mental Health Journalism Program. So I'm really grateful to be invited to this conversation. Carrie, I was hoping you could just, for the audience, those who aren't familiar, share how the mental health journalism and the media program at the Carter Center works, and how you're really, and it's been amazing for me to watch as an alum, really authentically engaging newsrooms around the world to not only deepen their understanding of mental health and trauma, but also to support them and reporting on those issues in a way that offers solutions-based strategies.
Yeah, thank you, Jimmy. Thanks for having me, and that's a great question. So the fellowships were founded in 1996 by former U.S. First Lady Rosalynn Carter, and the goal was to award fellowships on a global level. The grants to report on mental health, but also to provide a level of training on reporting on mental health from experts so that it could have a positive impact on the journalist's work, because as journalists, we have responsibility to do no harm, to tell stories accurately and effectively. And so we want to be cognizant of the context around mental health that we're reporting on, but also the language that we use. And I think, and Ben can attest to this, some of the work that we did in Liberia involved training journalists on mental health reporting as an extension of the fellowships. And it really reinforced for us the impact of reporting and language, and by extension advocacy on the efforts that we were trying to make there overall on a social level, right? And so while we were working with journalists, there were folks working on a legislative level completely separately. And so there was the impact of where it's coming from both sides, right? We're seeing changes on the legislative level, but also on a community level, trained journalists are able to contribute to that change just by doing their jobs effectively because they have the knowledge to do so through the training. And we realize that the program is, the fellowships themselves are essential, and we'll continue to do that because they do have an impact. But then we had to look, especially over the last couple of years, about, are we doing enough? And are we thinking strategically enough about what we're doing if we're trying to have any kind of social impact without crossing that social advocacy line, right? Because we want to be ethical about the work that we're doing, as that's important to me as a journalist and important to us as a program. And so we started to think about where journalism can intersect with policy, because we have a public policy team, because we have folks like Ben on the ground who can really inform that the work that we're doing on a communications and journalism level. And so that's where our idea for the Parity Collaborative, that involves multiple newsrooms from around the US and journalists working on looking at why folks in their communities don't have access to mental health care, even though it's a federal law, right? And so looking at it on a community level and exploring it from a solutions journalism standpoint. And I bring these things up because I think we're all involved in our individual programming and the things that are core to what our organization does. And while we want to be aware of mission creep that pulls us away from where we put our time and our energy and how we use our funding, we also want to think creatively and strategically within the existing models that we already have about ways that we can expand the work or have a greater impact on the work that we're doing. The other thing I do want to say is that the actual mental health reporting and the accuracy of the reporting, the effectiveness and the language is only part of it, right? The other part of it, as you mentioned, Jimmy, is the mental health of the journalists who are doing the work. And so one prong is making sure that folks have the tools and resources to do the reporting. But then the other prong is making sure that as they're doing this very difficult work, which can be very sensitive and have a mental health impact on you as a journalist, that you're prepared for that and that you're working through that as you're doing the reporting, because you can't do your job effectively. You can't have the impact that you want to have if you're not taking care of yourself as a journalist. And I think, like Jimmy, you've reported in some conflict zones and on some very difficult topics related to genocide and sexual assault. And so you understand the impact of it. I think journalists over the past several years have experienced mental health challenges through the job because of violence around politics, because of issues in the newsroom about equity, about social issues related to racism, et cetera. And so we need to think not just about how do we make sure that journalists are trained to effectively tell these stories, but that journalists are taking care of themselves in order to tell these stories.
Thank you so much, Carrie. I've been thinking about this throughout the conversation, and then actually one of our audience members percolated this into the chat. I actually want to see it's really for everyone, but I want to start off with Dr. Ben Miller. And how can the public, how can everyday people effectively advocate for their mental health support? I mean, you know this far better than I do, but it seems to me, ordinary citizens, as you and Mark knows have noted in this conversation, and Benedict, we know we're in distress. We know we're feeling a range of emotions for a sustained period of time. We know, many of us are dealing with crises, personal, micro and macro. But it seems to me, many people like the toolkit to argue for what they need. I'm just curious, how can the general public, whether it's in North America or in Africa and other parts of the world, how can people effectively advocate for their mental wellness?
I love the question, and I think it's something that we all in different capacities have tried to address throughout our careers here. This is a big one. And so let's kind of start with the simple things. I mean, number one, it begins with our conversations. And I love what Carrie was just sharing with us, because I think that language does change the culture. And the more that we can use language that's reflective of the culture we're trying to create, that's inclusive of mental health, the more likely we are to be successful in seeing some type of change. So it begins by talking about it. As simple as that is, conversations like the ones we're having, I do not think you can ever underplay how important it is just to bring it up. So that means that at school board meetings, at city council meetings, wherever you might be in your community, offering up the importance of addressing mental health is one of the first and most important things. Second, you got to know what you actually need to change. So some of this is a little bit hard for us because many of us don't actually know how bad things are until we get sick. So maybe you've had an experience with your friends, your family, your loved ones where they need help. And you were just assuming that it's easy to get that care, that access that you needed until you tried. And so most of us don't know how bad that is. We have to be able to at least acknowledge or highlight how bad the problem is and speak to that in order to offer up the solution. Because a lot of policymakers, and they're going to listen to your story, which is crucial. And I would say arguably one of the most powerful tools we have in our arsenal to bring about change. But they're going to want to know, well, what problem are you solving? And if you can't answer that, a lot of times the doors get shut a lot faster than they should. And so being able to articulate the problem, and then third and most importantly, have a clear vision of what your solution is. This doesn't require you to go to some fancy school and get fancy degrees. This just requires what's best for you and your family. And I said this in my opening comments, but I think that communities have better ideas of how we can systemically reform mental health than a lot of folks sitting in positions of power do. So how do we listen to each of us? The mom that's struggling with the daughter, the dad that doesn't know what to do with his brother, all of those stories that we've seen, we have to be able to articulate what we want from that. When you're able to do that, as Sarah and Mark and so many others have said, there is a business case behind you. There is evidence behind you. You don't need to go and do a lit review for 10 hours to find out that actually we know what works for addressing mental health. You just simply need to be able to articulate it in a way that folks understand that this is what you want, this is the problem that you solve, and this is the language that they need to use to reflect that new vision of good.
Thank you so much. And I'd love to invite our colleagues in the conversation to weigh in as well, if they move to do so. Any other thoughts or reflections on this?
Thank you again, Jimmy. Just to piggyback on Ben there. Yes, first, I think another way, as we're talking about it, which is very important, and then people have the information. From our experience here, it's also important to have that based in major instruments. So I'll say on the higher level, the policy first. So because why that is important, because then it creates and demand accountability. Because then it's in something that government or the stakeholders who are meant to take action, they have a blueprint. So that's one way. The other one is to still in line with Ben and Carrie is increasing access to information. So I'll work with the journalists, for instance. So it's not only that they report in a sensitive way, but they also increase access to information like what's in the policy. They help educate people on their rights and responsibilities, on the benefits that they have. So when the information is out there, communities, civil society organizations, they are able to access the information and use the information to demand what's rightfully theirs. And journalists also, besides increase in information, they take different stories, whether it is an economic situation, a political situation, and try to find and explore the mental health angle. What's the implication there during elections, and what does that mean? Political instability, how does that have mental health implication? So if there's a riot, and they're talking about how does that invoke fear and trauma based on country's history, and how people can be able to address that and what needs to be done. So all of these things are taking ordinary stories, taking other high-level stories that the mental health aspect would not be explored. Journalists are revealing those different aspects, get people to understand wider the situation. And at the community level too, I would say, working with key stakeholders like traditional leaders, religious leaders, they are very important, and people believe in them. People will go to them sometimes for services, and in other places, they are the ones who are providing some type of services. And so with getting them involved in this process, for instance, what we've done with them is train some community leaders, train religious leaders and traditional leaders to do one main thing: refer people to evidence-based services. And that seemed to work. They accepted it. So when community people are in need of information, when they have situations, they run to the community leaders and say, okay, yeah, you go to the hospital, you go to the primary care center, and you'll be able to get services. So at the community level, as Ben said, the community really understand their situation. They know they can help, they can provide the right information. And we saw the entire thing play here in Liberia when we had the Ebola crisis, okay? It was only when the government recognized the role of the community, how influential they were in terms of turning the situation around, that we started to see real improvement in this. So the community is very, very important. And just to conclude on this, I would say, still on Mark's point about talking about this, using this kind of platform, right? Increasing the awareness and using big players presenting the information as well. The CDC, the WHO, especially at the national level, where they have national offices or country offices in the country, making mental health a priority. And that is one way to keep it high and help people get the information and demand better services or treatment.
Thank you so much, Benedict. I want to launch from that, and actually, this is probably a question that's particularly for Sarah and for Mark. It's really, you know, and Benedict referred to, you know, obviously Liberia faced, you know, a highly viewed conflict and the Ebola crisis as well. But how do we best balance the short-term needs, whether it's financing, whether it's capacity building, education, in the midst or wake of an emergency or conflict or crisis? How do we balance, you know, the needs for mental health with the longer-term recovery efforts, the longer-term system building efforts? And this is really for Sarah and for Mark, but you know, if others want to jump in as well, I'd invite that.
I'm happy to speak on it, but Sarah maybe wants to go first. I don't know.
Okay.
I'll go first. So I think there used to be the concept of early recovery, meaning that you have an emergency. From the moment the emergency happens, you're thinking a dual approach. You're thinking one hand emergency relief, and the other hand you're thinking very much of long-term response. And there is early actions you can take early in emergency to have a long-term impact. And seeing Sarah here, Sarah worked in the Philippines and for WHO, and it was involved in mental health. And interestingly, I was in that emergency there in the first week. And what I did is I helped with the response, the relief, the priority setting, but I also walked around with a map of Sri Lanka, another country, showing how they had converted their mental health system after the tsunami. And I kept saying, this you can do too. And lo and behold, 6 weeks later, when the acute response was no more so acute, decision makers were saying, we want to have a long-term response, but they had been already knowing from my early education that they wanted a long-term response, and they brought in Sarah to do work on the long-term response. So one can work from the beginning, thinking of the long-term and doing both. Now, these days, they don't use the word anymore. Terms change and concepts change as they do now. They talk about the humanitarian development nexus, but it's kind of the same thing. It's the idea that you're thinking of humanitarian, you're thinking of development at the same time. Huge problem is that much of the big funding is often a little bit separated. So there's money out there for humanitarian response and there's money out there for development. The flexibilities are not so strong. Probably the foundations are better at being, the governments are a little bit rigid in the separation between those two tracks. That is an issue that is well known and is still not well enough addressed, I would say.
Thank you, Mark.
Maybe to add to that, Jimmy, then, so as Mark's saying, what you see in an emergency like we're seeing at the moment in Ukraine, and I used to work for WHO on emergencies, including on Ebola, as Benedict, is that you will get an outpouring of support, which is absolutely needed. But then when you're thinking about the planning for mental health and psychosocial support response, as Mark says, you have to be thinking already about recovery and longer term, if only for the very simple reason that people living with a mental health condition are going to need access to services, they're going to need access to medication for months, if not years. It's not a weeks or days issue. So from the very beginning, you need to be looking at partners who have that concept in mind and understand how to integrate within local systems. So the work that WHO is doing right now is so important with its partners, where they're mapping response agencies, not just in Ukraine, but in the countries surrounding Ukraine, so they can figure out where there is also access to support for mental health and services and psychosocial services, so that people can be directed to the right levels of support and we're not seeing duplication or wastefulness. But then the second point is then thinking about, okay, what happens longer term? Who are trained, who have the right language skills, who have the right context? To Benedict's point, most people will want support from their own communities. Are those communities able to respond to the needs of the people in their community? So there is a very clear continuum. I think the other thing to add to what Benedict and Ben have said more generally, and to Carrie's point, is when you're advocating for success or action on mental health, it starts with you, it starts with your own story, probably, and the story of those around you. But then it quickly becomes data. And so we've worked on what's called Countdown 2030, which is a data initiative to get as much data as possible easily accessible on mental health, so that people can look at what's happening in their country and then use that to advocate. We've worked with WHO, UNICEF and others on that. But then it becomes linking between global and national partners. So we run what's called the Global Mental Health Action Network, which has 1,700 members now from 117 countries. People are using global moments like World Mental Health Day or the MTV Mental Health Action Day that some of us are also involved in, is coming up soon. So using those moments to link what's happening globally with what's happening nationally. And in the Philippines, as an example, a couple of years ago, our partners in the Philippines recruited the then vice president to speak on mental health. She's now running to be president. So you build relationships with advocates for the longer term through linking on the global to national days. I hope that helps.
Thank you so much for that, Sarah. You're reading my mind, because I was going to ask you about World Mental Health Day. So we were challenging each other there. Could you, for the audience, World Mental Health Day is October 10th of this year. Sarah and others who feel moved to do so, could you just show us more about the importance of that day and what we might expect to happen on that day, and what are the goals?
Yeah, I'll very quickly say that the theme for this year is making mental health and well-being a global priority. So I mean a priority at global level, but also a priority in all countries and all places. So we're really pleased about that. And we and WHO work together year on year to help develop the World Mental Health Day campaign. So I will let others speak, but that's a very quick highlight that just came out in the last few days.
I think your words they speak for for the group. Sarah, thank you so much for that. A question, and this may be, oh sorry, this may be especially for Ben Miller, Dr. Ben Miller, but it's really for everyone, and it's more of a, I have to confess, of kind of a personally motivated question. And it's a funding question, so it's really for all of you. You know, both in this conversation and from our audience questions, funding has been a consistent theme. And I'm curious, and I think Ben Miller's going to weigh in on this especially, but how has the philanthropic community shown up in supporting mental health innovation and capacity building education? Again, philanthropic investment in mental health is new to me as an issue. I'm still learning about it, but I'm just curious from your perspective. You know, private funders, foundations, corporate philanthropists, and so forth. Has there been consistent, sustained support from those parallel communities, and what don't they know? And I ask that because, you know, in philanthropy, you know, it's very much about measuring impact and scale and system transformation. And I know from my chapters in journalism, the field that sometimes those things are hard to measure, at least in the near term. So I'm just curious, how is philanthropy showing up or not showing up, and how can we help build better understanding and relationships in terms of funder support for mental health efforts?
I love the question. And just for those in the audience that aren't familiar, Wellbeing Trust is a national foundation that focuses on advancing the mental, social, spiritual health of the nation. While we hang out in the US, we have a lot of partners like those at this table and get to learn from other countries and what the successes have been. But Jimmy, to your question, I think that foundations and philanthropy writ large has an opportunity to really step up and provide leadership where there are major gaps. We know that the financing of mental health, as my colleagues have already alluded to, has been less than desirable. And hearing Benedict describe, you know, the $25,000 budget just is, it just makes my soul hurt, because here we are, at least in the United States, where we spend way too much money on healthcare, and mental health is a fraction of that. It just begs the question, like, what are we doing with our resources, and how can we best reallocate those very precious dollars into the places that actually matter? So what traditionally has happened is that foundations have funded the things that nobody believed in. And I'll start with a couple of examples of this. I mean, one, there's this concept that we've all danced around today of bringing mental health into primary care. It's not a new concept. It's been around for a couple of decades now. But when it started, there was no way to financially sustain it, no way to fund it. And foundations were the ones that were usually stepping up and saying, we got you here. Go ahead and do what's best for the community. We will pay for that. Now, you know, several decades on, we have finally seen policy. We've seen some movement in the payment that allows it to be just ever so much more sustainable. I'll give you another example. While you may not think that this is related to mental health, it absolutely is. The 911 system here in the States, so the emergency call system that we all dial if there's a heart attack next door, a fire across the street, or a cat in the tree, this is what we call. And the 911 system for almost 2 decades was sustained by a foundation. They recognized that there was a need to have some emergency response across the country. And the only way to get that going was for them to foot the bill. So I think the foundations have had a major role to play. Now, where we have some pitfalls, and this is more of a critique than anything, is that we all like to do our own thing and lay claim that that was ours. It's what I think of as disconnected brilliance. Okay, there's a good thing here, a good thing there, but rarely do we come together and say, let's collectively fund an opportunity that could be transformative for the country. And if we could figure out ways to be more aligned with our philanthropies, then I actually do see that as a tremendous way forward. But that requires some culture change. It requires convincing boards, it requires measurement alignment, it requires a whole lot of other things that I don't think we have time for today. But I would say if you're a philanthropy on this call, if you're a foundation on this call, there are some wonderful tools out there that you can make yourself available to you that would be useful. We've worked with an organization called Mindful Philanthropy that has really tried to bring together organizations on what they might want to fund for mental health. There are donor advice guides. There are organizations all over the world now that are emerging that will help direct you towards what might be the best use of your dollars. What I would say, in just closing here, is that if you are a family, if you're a foundation out there, the best thing you can do to help meet us in this moment is to not go it alone. To reach out, talk to one of your friends that's in this space, talk to one of us on this call, and let's figure out a way to make some connection to alignment, because that would actually could lead to a place that we are seeing major change.
Thank you so much. I see Sarah going to have their hands up. I'll go to Sarah first, because there's actually a question in the chat as well that I think Sarah wants to answer. But Sarah, we'll go to you first and then Benedict.
Thank you. I think that there were a couple of questions in the chat that have been raised that I think are things that people can speak to in the call, including around community health workers, but I'll leave that one to Benedict. In terms of other areas, though, there's a question about US funding. So I think Ben is very right around philanthropic funding. There are increasing numbers of philanthropists who are interested in funding mental health. I have to say that the number who are interested in funding mental health internationally are very, very small. There is a lot more funding that's going into philanthropic funding that's going into American US mental health needs, which is absolutely understandable. I don't mean to critique that, that is important, but just to be realistic about it, there are only 2 or 3 foundations I can think of who are putting serious money in at a global level, and it's still very small. And large organizations such as the Bill and Melinda Gates Foundation are not consciously funding mental health. They are supporting some elements, but they have made a decision not to fund it. So there is a long way to go on philanthropic funding. There's a lot more to be done. But there was a question as well about the US government and its overseas aid. And I just wanted to highlight the Mental Health Act that is currently in discussion in Congress. It's a really important piece of legislation that would push USAID to fund more mental health services and support, and they would have a dedicated coordinator. There will be regular reporting, and we consider this to be a real step forward, and also a good example that could be used by other countries to help improve levels of funding for aid. We work closely with the US and many other bilateral donors, but it's very encouraging to see this potential for legislation and then funding. Thank you.
Benedict?
Yeah, thank you again, Jimmy. I just wanted to throw a little light on the funding aspect. I think from my experience here, one big issue is actually making the case with the right information. And I say this because we know that resources are always limited. And for countries such as Liberia, and that's even worse. And governments all over the world, they have to make the economic decision, right? And so in terms of getting funding, sometimes we have to make the case with the right information. And so that's why we did this study with our United for Global Mental Health. It was the first mental health financing study ever done. And we're hoping to release the study anytime soon. But I'm speaking to this, we had a meeting with one of the legislators, and we want to talk about financing and increasing the budget for mental health. And then he said, oh, but we've already done that, and we increased that to 50,000. So the current budget now is 50,000. And that was interesting. So I had a copy of the study with him, and I showed him. So I just pointed out the place for him to look. And he started saying, oh, wow. You mean this is it? I said, yeah, that's the bare minimum. And this is the closest estimate I know we're talking about. And he said something to me. He said, if I had this information before we passed this budget, I would have had something substantial to make my case to the floor. And so we took that seriously as the committee, visiting him. And so it's important to get the information and share. Now, I mean, that ultimately doesn't mean that something is going to happen, but at least we are providing evidence for how this should be. And the other thing is speaking in the language and of the people who we want to invest in mental health, and getting non-health actors are also involved. Talking to the finance minister, we know that when we talk with the finance minister, we should be talking about greater value for money, the return on the investment, the return on the individual. We have to be demonstrating this, with the data that we have. That's what they want to see, because every time they say to support mental health, it means taking money from somewhere, and we have to justify that. And so we learned that over the time that this is the way to go. And importantly, we have taken the entire national budget schedule to work with it out. What would it do at a certain point in time? We want to be sure that at every stage of the budget development, we are working with the key stakeholders, people who can make the right influence, can help us change things, to get them involved, provide them the information to help this. So we hope with that strategy, we will see greater investment in mental health in terms of Liberia's budget. I'd like to quickly respond to one question in the group from Matt French about working with community health volunteers. Yes, we have worked with community health volunteers. I would say one, during Ebola, they were very instrumental, because we did psychological first aid with community volunteers, and they were the ones that part of the frontline workers there doing contact tracing. So coming to people, engaging people who were in crisis, they were able to provide initial support and link them with the right resources or support system. And as part of another project, the Thinking Healthy project, which is a psychological intervention for managing perinatal depression, we have also trained community volunteers who are working along with health workers at the facility level. So they are really involved in identifying pregnant women who fulfill the eligibility criteria to be a part of the study, and they are increasing awareness on depression and treatment as well. So there are several programs that we've gotten them seriously involved, and we know the power of working with community volunteers.
Thank you so much, Benedict. We have just a few minutes left, and I want to create a space for each of my colleagues and panelists here to leave us with a succinct message or call to action, or a critical statement about this conversation, but also future conversations. As all have noted, we have to continue discussing, comparing notes, comparing our respective experiences and expertise to move not only our respective national agendas forward, but also have a unified global approach to mental health financing and capacity building. So I actually want to start with Carrie, and then start with Carrie, and now with Mark, Benedict, Ben, and Sarah. So Carrie, could you start us off with just a closing statement?
Yeah, if there's one thing that I want folks to take away beyond the investment and the funding and the project side of it, is that as an individual, if we're looking for something immediately actionable, we can just start thinking about what our own mental health story is and how we communicate that story and the language that we use about it. That's it. Just think about the way that we speak about mental health, because the way that we speak about mental health affects the culture around us, right? So as individuals, if we just focus on our language, I think that is a sustainable impact that we can each individually have.
Thank you so much, Carrie. Mark?
I just want to reflect that the times in my life I have seen mental health leaders pick up mental health, that it's been remarkable for them, because there's so much to be achieved and it's quite easy to make a big difference. So for any, similar would be true for any philanthropist. If you jump in this area, there is so much opportunity for making change, because it's not a very crowded area. and you will get good visibility and good satisfaction.
Thank you so much, Mark. Benedict.
Thank you again, Jimmy. I would just like to stress that whatever we do, we have to think about the long run, and we have to build systems and put structures in place, understanding or considering that they need to be sustainable. And this will involve building the workforce that's going to be on the ground to provide support. This will involve promoters, establishing strong policies to drive or mandate better services and support. And this also means supporting human rights and inclusion, working with mental health service users, persons with lived experience, getting them in the forefront to advance the advocacy to see greater changes for mental health.
Thank you so much, Benedict. Dr. Ben Miller.
Jimmy, thanks again for the opportunity, and to my fellow panelists, I learned a lot and I appreciate your time and your leadership. You know, Churchill famously said, out of intense complexities, intense simplicities emerge. And this is an inherently complex topic because of how many different layers of structure that we built over the years that just haven't worked for mental health. The simple thing, though, is that we can show up for each other. Today, make it a goal for yourself to ask someone how they're doing and really be prepared when the answer comes back that's something that you're not necessarily equipped to handle. Be there, listen, support, show up. I think the more that we show up, the more that we allow people to be heard, the more likely we are to begin to create a healing culture across this world where mental health is a priority. So thank you.
Thank you so much. And Sarah.
Thank you for the opportunity, and thank you to all my fellow panelists. To build on what has been said, as I mentioned, MTV's Mental Health Action Day is coming from the 19th of May, and the theme is connection. So as Ben and Carrie in particular both said, connecting with others is so important. Mental health starts with a connection, a personal connection, and an ability to empathize and listen. And I think that's a connection that couldn't be more important at this time. And I think if we keep working together, World Mental Health Day, this opportunity to make mental health a global priority, those are the things that will keep us going, because we need that connectivity and collaboration to make change happen. So thank you all very much.
Very well said. A great closing out, Sarah. Thank you for that. And thank you all in the audience for joining us. And we were a few minutes over, but I hopefully you feel it was worth it. I think it was, to garner the insight and wisdom of my colleagues here. Thank you for joining this session, which was mounted and hosted by the Carter Center.